So for the next part of our semester project, we're going to somewhat step outside of the specific documentation portions and moving one by one to talk about writing expected outcomes and anticipated goals. Now, depending on where in the evaluation or care plan you're including the prognosis is where you will include a lot of these goals and outcomes. And so these fall in that same area as the prognosis as far as kind of in between evaluation and plan of care. So you'll use the same components in both. So we're going to first talk about how do we write these, and then we'll get into the specifics of where they might go as well. So this is chapter 19. When we look now at expected outcomes and anticipated goals, but expected outcomes are very much going to be the long-term goals, very prognosis components associated with it, whereas the anticipated goals now are going to be more of the short-term goals associated with there that are more associated now with the plan of care. When we're looking at goals, we basically follow the ABCD, audience, behavior, condition, degree, whereas the audience obviously is going to almost always be the patient, but in certain instances, like if it's an education component, it might be somebody else. The behavior is what we want the patient to be able to accomplish, right? C is in what situation we want that to be done. And then D is basically our ability to assess or measure that component. So you can see here in this, the main goal for the behavior is to be able to reach overhead into overhead cabinets, whereas now in the degree, that means they need 165 degrees of shoulder flexion. Now, notice that the behavior is an activity we want them to be able to do, whereas the D is the components necessary to get there. All right, so when we look at goals, we often want to include in there, right, a time frame that often comes in the D component as well. And then obviously we have an order that we go with. For our worksheet then, we're first going to go through with written goals. So these are written already for you. And you're going to identify the audience, behavior, condition, and degree. Again, if there is nothing written in here, in this case for the audience, you can assume that it is the patient. For the second part now, you have some different components here as far as anticipated goals, right, or expected outcomes in there, and you're going to identify in which section might this be most appropriately identified, either in the evaluation, diagnosis, or prognosis. And then finally, in the last component here, you're going to write out the missing component within the goal. So you have a partial goal here. You need to then identify the missing component to form a complete goal. So you would rewrite this as a complete goal. And then I misspoke. You have one more component with their very similar in nature, but now you're going to write the component that's missing and create that anticipated goal.